Hi, I'm Jonah Comstock, Editor-in-Chief at pharmaphorum. I'm here at ASCO 24. I'm joined by two researchers from Johnson & Johnson, Henar and Carolyn. They're going to introduce their full names and titles so I don't get it wrong.
So, Henar Hevia, therapeutic area lead solid tumors in Europe.
Carolyn Sousa, commercial lead for solid tumors in Europe, Middle East, and Africa.
So tell me a little bit about kind of what are the top headlines for Johnson & Johnson at ASCO. You have a lot of abstracts here. What are the ones that, the really big stories and the ones you're excited about?
Yeah, we are excited about our presence this year at ASCO because we are publicating, showing 34 publication, clinical and real-world evidence data for our hematology portfolio and solid tumors oncology portfolio as well. So yeah, a lot to come. We are presenting innovative treatments and being lung one of our main areas, but we are working on prostate and bladder as well. So, but yeah, as you already may know, lung is now the first leading cause of cancer death in Europe. So we have a high focus on that, and we are presenting innovative and very interesting data in this Congress. So very excited.
Anything to add, Carolyn?
Yeah, maybe I'll just talk a little bit about the fact that J&J is really leading where medicine is going. And one of the things that I think is amazing about the data that's coming out here, not just from J&J, but across the business, is the work we've done in bringing new mechanisms of action, new ways to treat cancer. So, thinking about things like radioligand therapies, thinking about antibody drug conjugates. Particularly, I'm very excited about the bispecific antibodies that we have in our portfolio. And I was saying to Henar earlier, when I first started working in this industry, we thought TKI inhibition would be the way that we can treat different diseases, especially in cancer. And I'll never forget my first ASCO, walking in and seeing anti-VEGF therapy and the advent of biologics and what that has done for patients. But now when I just see the breadth of possibilities, both from what Johnson & Johnson is bringing, but across the industry, it makes me really hopeful for cancer patients.
Are there any specific studies or drugs that you guys are excited about this year from Johnson & Johnson's portfolio?
Yeah, maybe to highlight the importance of, targeted therapeutic treatments. Because, for example, in lung cancer, we have EGFR mutations in non-small cell lung cancer, which is really prevalent in this disease. And we know now that in the first line setting, we have a high prevalence of high risk patients, high risk disease, with unfortunately a poor prognosis. So it's very important to have targeted therapies in order to have, the best possible treatments and the best outcomes for patients. So it's something that we are seeing this in this Congress. We are seeing it. So yeah, we are excited about it and much more to come. Absolutely.
Maybe I'll just add to that a little bit of a personal story, right? I mean, lung cancer for me, it's really meaningful to be working in this area. This is a disease where, 25% of patients don't even make it to a second line of therapy. They can hope to have 2 years of survival, particularly by the time they're often diagnosed in advanced metastatic disease. My father-in-law died from lung cancer. He was diagnosed far too late. And as a result, he didn't see many of the things that all of us want to see when we're older and retired, right? And I think now with what we are bringing as a company and what we see as the possibilities, maybe he would have been able to see his son marry me. Maybe he would have seen his grandchildren. So I think that's the area where I'm most excited about the work that J&J is doing.
Lung cancer seems to be a really major topic at the show this year, especially. There seems to be a lot of news and a lot of abstracts. Tell me, you mentioned this variety of different approaches. What are some of the most kind of exciting innovations and developments around lung?
I think that as I mentioned before, the targeted therapies is one of the most exciting news because we can go for the specific treatment, the best treatments for each patient. Because that cancer is not only one disease. We are talking about different diseases when we talk about cancer. So it's of critical importance to test the patients, to go in more detail into the genetics of the tumor, of the cancer, in order to be sure that the treatment is going to be the best one. So that you can see the best outcomes in the patient. So I think it's the most important thing. And it's true that we need to have treatments that are convenient as well for patients, so efficacious, well tolerated, and convenient. For example, treatments that are very easy to use for patients and providers is a good thing as well. So it's what we are seeing here in this Congress, that kind of approaches, innovative and very practical.
I mean, maybe to just mention and add on to that, right? I mean, Henar said it. The genetic mutations are some of the key drivers, especially in lung cancer. And we're seeing more and more therapies that are specifically targeted to some of those genetic drivers.
Yeah.
One of the most important is EGFR-mutated disease. This is a type of lung cancer where, unfortunately, most patients get this even if they haven't been smokers, right? So there's a stigma associated with lung cancer, but for this subpopulation, it's not associated with smoking. And seeing targeted therapies that are going after specific genotypes like that is really, I think, a great potential and great possibility for patients. But I think it's also an area where, particularly for us in Europe, we're not doing enough to make sure that patients have access to the testing, to the next generation sequencing testing in particular, that's needed to distinguish between these different types of genetic mutations, and thus enables physicians to pick the best therapy. And the other reason I think this is really something I'm passionate about is because it will help alleviate the burden on our healthcare systems if physicians can pick the therapy that is most likely to be effective for a particular patient.
So what are the burdens that stand in the way of those assays and that testing? I mean, you mentioned access, but even innovation, right? Sometimes there isn't a strong assay for something highly gradiated variation on a cancer. Whose shoulders is it on to sort of fix that part of it?
Great question. Maybe we're talking about FGFR.
Absolutely,
You want to
yeah.
talk about FGFR?
Yeah, no, EGFR, is very common in patients. So as we were talking before, the prognosis is poor in this type of patients. So we need to have specific treatments like bispecific antibodies, for example, very targeted, that are going to be linked directly with the right receptor in the tumor cell. So it's the future. It's the future. We were talking about pipeline and future assets. We are going to have antibody drug conjugates, for example, which are a mechanism of action really specific, trying to target more efficacious treatments and much better, well tolerated. This is our aim, because in J&J we are we're committed for changing the trajectory of the disease. This is our vision. So for that, to first be sure about the specific type of cancer that the patient has first, and then to offer the best targeted therapy approach in order to have the best outcomes. So it's a little bit story.
Yeah, and I mean, to your question, right, this is where meetings like ASCO are so valuable, because it's not just about any one company. I mean, J&J, one of the things that we've been able to do while we're here is to meet with our partners, for instance, that have these types of diagnostic tests that are bringing to market the tools that pathologists need to be able to define different patients and match them to the right therapy. And I think that's the really important thing about congresses, is bringing together the companies that have the treatments for these patients, the companies that are developing the tests to help us identify these patients, and then the clinicians that ultimately are able to match the right treatment to the right patient just when they need it.
Great. Very important. Well, I have one more question before I let you guys go. I've been asking this to everybody. What advice would you have to a young professional just entering oncology right now?
Wow,
That's a
interesting.
great question.
Yeah.
Do you want to go first?
Yeah. Just to stay curious, because science is advancing in a really fast way. We are going to be advances in the next 10 years that we didn't see in the last 100 years. So to stay curious, to study, to be in that kind of congresses, to be aware of the last, scientific data approaches, etc., new mechanisms of actions, approaches, trends as precision medicine, the importance of genetic testing. So be curious and stay connected with the community. Yeah.
I think that's totally true given the innovations that we're making in treatments. But I also think that it's really important oncologists remember the patient behind the treatment that they're providing, and that treatment is much more than just the drug. They need help from a dietary standpoint. They need help from physical therapy, mental health. It's a really important that they not only stay curious, but also work collaboratively with all of the different allied health professionals that can help make patients' experience of treatment as good as it possibly can be.
Yeah.
I can't agree more. As always, Carolyn.
Well, thank you both so much. Really appreciate your time, and I hope you have a great rest of the show.
Thank you. You too, Jonah.
Thank you very much, Jonah. Nice to meet you.